Hello everyone, I'm Katie with Taylor Physical Therapy and Wellness. I am coming to you today with part 2 of our lymphedema series. Last week in part 1 we discussed diagnosis, so who does lymphedema affect and what goes into diagnosing someone with lymphedema. So please check that video out if you have not, and post a comment or a question if you have any regarding diagnosis of lymphedema. So today we're going to be discussing treatment. So when someone is diagnosed with lymphedema, what do we do about it as physical therapists? So the most important thing to understand is that, again, everyone who is potentially at risk for this condition is screened when they receive a diagnosis of cancer, at least given risk reduction education for those patients. So if we are able to provide education, patients know what signs and symptoms to look for and be aware of, they're much more likely to be able to detect lymphedema early. So managing and treating lymphedema is much more effective if we can do it in the early stages of that disease process happening. So early detection of that, again, is key to treatment and management. So in terms of our treatment approach, we really want to have, and the standard of treatment is what's called Complete Decongestive Therapy. So that is something that involves a basically comprehensive approach, both including wrapping and compression, exercise, and some things that therapists will do. So again, number one is a manual technique called manual lymphatic drainage. So that is something that physical therapists receive specialized training to do. And so the goal of that, again, it's called manual lymphatic drainage, is to ultimately get that lymph fluid that, again, has accumulated abnormally so in an area of the body back either into a lymphatic vessel so that it can be reabsorbed and returned to circulation in the body, or two, that the patient will just be able to excrete the additional fluid that we are moving. So manual lymphatic drainage is a technique that is very light in terms of the amount of pressure. Say, for example, someone has some swelling in their arm. It is something that is a very lightly applied technique that involves two really techniques depending on the training that the therapist has, but one is to actually move the fluid back inside of a vessel, and then we also do what is called lymph node stimulation, which is essentially where we work anywhere in the head and the neck. We have clusters of lymph nodes just here above our collarbone, underneath the armpit, and then often we work sort of along the breast tissue or in the trunk, again, depending on if someone has lymphedema in their upper body or their lower body. So the manual lymphatic drainage is a really important piece of that. So the second is to provide the patient with some form of compression. So to really actively reduce swelling, we need to be able to maintain that volume reduction once we have done the manual lymphatic drainage. So that can look like multi-component bandaging, which is a combination of short stretch bandages, foam rolling, and a few other components that are often used to provide the arm compression. The compression systems that are available and out there have come a long way in the last 5 to 10 years, and there's often compression systems available that are much less bulky and that are much more user-friendly for patients. But this is really important. For example, if a woman has had let's say an axillary lymph node dissection and she is scheduled to begin radiation therapy, it's really important that we are able to get this patient and assess for lymphedema, and also to get her into a compression garment ahead of radiation therapy beginning, swelling. We know that is a known trigger for many patients to develop lymphedema. So that's one example in which we would want to provide some form of compression ahead of time. So in addition to that, just a lot I mentioned earlier, patient education, because risk reduction is critical for even if someone does have lymphedema and they've already been diagnosed, what steps can we take to minimize the swelling to get worse, reduce the risk of infection, for example, of something that's called cellulitis. There are several things that can increase and intensify swelling. For example, heat. If a patient were to get either a sunburn or a burn in and around cooking, for example, anything that can irritate and inflame our skin can trigger lymphedema, or again place a patient at risk of developing an infection. So just a lot of different education things that we really try to impart to our patients, things to be mindful of, things to avoid, and things that are safe to do. So two more components to complete decongestive therapy. Exercise is a really big hallmark of treatment. So often women are not sure what is safe to do, what they should be doing following a diagnosis of cancer anyways, and then compiling that with a potential diagnosis of lymphedema. Physical therapists are really the specialists that need to be providing patients with an exercise routine that is safe to do, and will work in conjunction with the compression garments that we have issued to them to just further maximize the volume reduction that we want to see. And then finally, skin care. So I briefly touched on this with heat as one example, but we really want to be making sure that the skin is clean and in excellent condition, because again, any skin irritant, even something as simple as a mosquito bite in the summertime, to a sunburn, to wearing too tight of a wristwatch, can often be enough to irritate the skin and again open things up for the potential of infection. So complete decongestive therapy is the gold standard of treatment for someone that is very newly diagnosed with lymphedema, all the way to someone that has had it for decades and has very involved swelling and what's called fibrosis, or a hardening of the skin. Every patient is going to have a different presentation of this, so your symptoms are going to look different potentially than someone else's. So that's really why it's important for patients to be evaluated by a specially trained physical therapist and given an individualized plan of care to sort of have a game plan, if you will, to address this. So if you or someone that you know, again, has either been diagnosed with some form of cancer, has had radiation therapy, has had lymph nodes that have been either, again, removed as part of treatment or just as an exploratory surgery, this is something that they are at risk of developing. So please comment or like or tag someone again that may need to hear this or would benefit, and I will get back to you next week with our part 3 of this series, and so I look forward to sharing more information then. Have a good day.